The negative symptoms of schizophrenia include abolition, a total lack of motivation, to the point of not being able to pursue any sort of goal, including seemingly simple things like making or taking a phone call. Anhedonia, an inability to experience pleasure from social situations or physical activities like eating, touching, or sex. Social withdrawal, lack of interest in being with other people. Difficulty paying attention, staring off aimlessly while someone is speaking, for example. Apathy, this might show up as lack of personal hygiene, or a lack of concern for yourself or others. Affective flattening, an absence of affect or emotional expression, such as unresponsive facial expressions or vocal tones and very little body language or movement. Alogia, difficulty speaking, which might mean a significant reduction in the amount of words spoken or in the ability to speak with ease or use. Detail when communicating. And what about cognitive symptoms of schizophrenia? There's some overlap between cognitive symptoms and both positive and negative ones, but cognition can be defined more narrowly as the capacity to think through and solve problems, explains Dr. Margolis. This is the kind of a thinking you would get on an IQ test, for instance. The ability to generate a certain number of words in a period of time, or the ability to connect one idea to another, he says. Most people with schizophrenia do have some cognitive problems compared to where they were before they became ill. The way their brain works and processes information can become weaker, and cognitive skills they used to have are harder to perform because their brain isn't functioning normally. What's the difference between schizophrenia and psychosis? Psychosis is symptoms, hallucinations and delusions, that can occur in a number of different entities, says Dr. Chen. For instance, someone who is on cocaine or methamphetamine can have psychotic symptoms, so can someone at the very extremes of depression or mania. And of course, so can someone with schizophrenia. The distinction, says Dr. Chen, lies in how long symptoms last. Substance-induced psychosis is reversible. Once your depression resolves, the psychosis goes away. When you treat the mania, the psychosis goes away and you don't have to treat it anymore. But in the case of schizophrenia, the psychosis is enduring. And if you stop the medications, the psychosis will invariably come back.